All right, well, we're going to go ahead and get started. We know others are going to be joining shortly, but wanted to start by saying welcome. This is Joy Burkhardt from 2020 Mom, and we're so pleased that you're with us today for the Mental Health Day of Action, or Mental Health Action Day. You're going to hear it referred to in both ways. It's the first annual Mental Health Action Day hosted by MTV, and along with over 1,000 organizations, both public, private, nonprofit, and a great number of organizations and partners a part of the entertainment industry, which is quite exciting. We're really glad to be a part of the movement. We want to invite you to use the hashtag Mental Health Action if you post on social media today. Thank you, Becca, for dropping that in the chat. I have the good pleasure of introducing our team. I want to share that Crystal McCulley's with us. Crystal, give us a wave. Becca Bischoff from the 2020 Mom team as well, who will be presenting today. And then, of course, Kay Matthews from the Shades of Blue Project, a deep partner of 2020 Moms, who's really leading the effort on Moms Matter, and we get to be by her side. So grateful for this team, and also just want to share with all of you before I turn it over to Becca that we're just glad you're here, and we thank you for being brave. This is the time more than ever to address mental health and to address maternal mental health. It's an intersectional issue, and we're so glad you're here. Becca, I'm going to turn it over to you.
Thank you, Joy, and just welcome again to everybody who's on this call today. Just appreciate, again, like Joy said, for your advocacy and your time today. I'm just going to give you a brief overview of what will be happening today. You are going to learn how to find your legislator. You're going to get some information about the specific bill that we're talking about, the Moms Matter Act, just a great overview of what that entails. We're also going to go over a script for you so that you'll know just exactly what you need to make those phone calls. Some of you on here may have done this before, but some of you might be new to it. So we're going to go through just some examples of what you could say when you call to ask for their co-sponsorship, or if you find out that they have already co-sponsored, you will find out just how to thank them for the work they're already. And then we will have some Q&A time to just kind of go over if there's anything that wasn't clear to you. And the super fun part is we're going to do a mock call where you'll kind of get to see Crystal and I together go through an example of what a phone call might be like. And then we'll all go on mute and we'll call together. And I think you'll just be really encouraged by and empowered by all the moms on the call who want to make an impact and change as well. And then we'll close it out with some feedback and everybody sharing what worked well, or maybe some things that didn't, some questions that you might have had. And so with that, I'm going to turn it over to Crystal.
Hi, Becca. Thank you very much. I just wanted to say, if you are on the call, if you could please go ahead and mute yourself. I think most people are, but we're all living that sort of universal experience of working from home. Garbage man, the sirens, all those sorts of things. So thank you very much for rolling with the punches there. And so thank you, Becca, for the introduction. And I'm excited to give you all just a very quick lesson on how to find your legislators, so you will know who you're reaching out for today in support of the Moms Matter Act. So I'm going to go ahead and share my screen. Sam, thank you very much. There are two links coming in your chat that I'm going to refer to here in just a moment. Thank you, Sam. So first, we're going to show you how to find your representatives. So if you click on that first link, it'll take you to the United States House of Representatives website. All you're going to do is type in your zip code. And you can go ahead and do this live with me now if you like. You will want to notate who you're calling today. So you're looking for a name in usually the Washington, D.C. office and a phone number. You're also going to want to take note of that because we're going to ask you to provide that information back to us so we can help track who all we contacted today. So you'll see here that this shows that I have 2 possible representatives. So I'm going to have to filter my info down a little bit further and put in my home address. You all can send me nice letters here if you like. Oh, heavens me. Okay, which one are stairs? Taxis? And there we go. That should load up an address to show me that my representative is Mike Thompson. And this takes me live to his website. So I can filter through here, find an email contact for his office in Washington, D.C., contact Mike. There we go. And that's where I'm going to want to notate his contact information. I'll give you all just a minute to go ahead and find your representative in the House. And then if and when you're ready, you can click on that second link, which takes you to the Senate website. So you're each going to have 1 representative and 2 senators per state. So here on the Senate website, you're going to scroll down. I'm going to again choose California. This brings up 2 people, but this time both people are relevant to me because you should have 2 senators that you can contact and 1 representative for your address. So you can see the Senate site makes it really easy here. They put up that Washington, D.C. phone number and address. So you can go ahead and notate those as well. And just a bit of housekeeping. If anybody has questions as we go, please feel free to put those in the chat. You can chat me directly. You can chat to everybody. You can send messages to Becca or Kay or Sam. We're all here to help support you do this. This is probably one of my favorite ways that we advocate right here, because this can make real change happen in real time. So to that end, Sam, I'll turn the screen sharing back over to you, and then I'm going to drop our Google form into the document, heavens me, into the chat. And then that way you can let us know which representatives and senators you are contacting today. That is in there now. All right, has everyone found who you're contacting today? Do we need another minute or 2? And it's totally fine that you have your cameras off, by the way. Feel free to turn them on if you'd like to say hello, but no pressure from me at all. Okay. Well, to that end, I will go ahead and turn it over to the amazing Kay Matthews from the Shades of Blue Project. Again, Laura says, can we get the Senate link again? Absolutely, coming right your way right now. So Kay Matthews, who's been leading the charge from the Shades of Blue Project on support of the Black Maternal Health Momnibus and specifically the Moms Matter Act. And Kay, thank you so very much for your continued allowance of our partnership. And we're so excited for the mountains you're moving. And thank you for giving us a bill overview today.
Thank you so much, Crystal. Welcome, everybody. Of course, if you have not heard, the Black Maternal Health Momnibus is composed of 12 different bills. And today our focus is around the Moms Matters Act. Okay, so this is led by Representative Lisa Rochester and Senator Christine Gillibrand. And so this particular bill is really near to me because I helped to craft some of the language and some of the input to make this really a key community component involved in this particular bill. So one, it establishes a grant program to expand access to treatment and support for maternal mental health conditions. That's important for all of us. I mean, this bill, although it is focused around Black maternal health, this is going to help us all. Providing funding that allows for the ability to grow and diversify the maternal mental health healthcare workforce system. In other words, building a system of care that we see folks who look like us that can kind of identify maybe what we're going through, which will also help expand the way we receive care. And of course, the investment in community-based organizations that are focusing on pregnant and postpartum birthing folks, including around the substance use disorder. So that's important, right? We need funding to do this work in a capacity that that reaches more and has greater impact. So the funding piece is very important. So this bill really encompasses where we are in maternal mental health right now, specifically in the Black birthing community, but for all. Again, this whole entire package is not just going to help the Black birthing population, it's actually going to help us all. We can solve or help to create framework that betters one population is certainly going to trickle down to all. So that's a real life overview of what the Momnibus, the Moms Matter Act and the Momnibus package really offers us. So I'm going to turn it back over to Crystal.
Thank you so much, Kay, and thank you so much for your dedication to this important piece of legislation. I just want to ask before we go forward with doing a demo call, does anybody that's joined us so far today have any questions? I know we've had a couple people trickle in the last few minutes. You might need a minute to catch up. We can resend forms in the chat message. Does anybody have a question they want to ask about the bill, about something that you want further insight on, or maybe a way that you want to understand for a good hook when you call today, something that you really want to bring up that you think is important about the bill? Or maybe, Kay, I'll ask you, if you get your legislator on the phone, what's the high level overview you're going to say that really matters about the Moms Matter Act?
Well, it's me, so it's full circle. I'm going to run through like all the 3 key points that we're touching on is that we need the funding. We need this particular focus around the care, the extension of the care. So I think for me, what I'm really going to most focus on with my particular representative is funding, and because that moves people. And you just have to be honest of where you are and what state you're in and how that whole thing works. So for me, I'm going to really hone in on the funding piece for community-based organizations, and then everything else will follow into that. So I'm going to run through the whole little overview.
I love that. Thank you very much. I think one thing that I always like to touch on is diversity of the workforce, right? And the funding to do that, and how important it is to have someone who understands where you're walking and talking in life, and understanding the cultural competency piece really speaks to me. So that's one thing I like to highlight too. Does anybody else have a favorite bit about the bill they'd like to say before we move on to our demo call? Well, awesome. Well, thanks you again, Kay, and we greatly appreciate your time. And Becca, I'll go ahead and bring you back on, and we'll go ahead and do our quick demo call before we turn everybody over to make their own phone calls. Are you ready?
I am ready.
Okay, fantastic. So 2 things I want to highlight before Becca and I give you our little demo is that if you're calling someone in the House, so your House of Representatives member, you are calling specifically about HR 909. That is the bill that you want them to co-sponsor today. Oh, you know what, Sam, would you mind dropping the link in the chat to the script that we will talk about here in just a second? Thank you very much. Appreciate you. So if you're calling your House of Representatives member, you're calling about HR 909. If you are calling one of your 2 senators, you are calling about Senate Bill 484. So those are companion bills, meaning that one's running on the House side, one's running on the Senate side. Our focus right now is getting from the current just under 30 co-sponsors of HR 909 up to 65. We understand from the author's office that that's the number where a committee will really look at taking up this piece of legislation. So that's going to be our main focus and push today. So Becca, we'll go ahead and take it away with a demo call, open it back up for questions and answers before we all start making a few live phone calls. All right, so Becca, I'm going to give you a call.
Ready.
And I am a constituent of your office. Ring, 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 ring.
Congressman Thompson's office. This is Becca. How may I help you?
Hi, Becca. My name's Crystal McCauley. I'm a constituent of Congressman Thompson's. I'm here in Napa, California. Thank you so much for taking my call today. I'm calling because I would greatly appreciate Congressman Thompson supporting HR 909 by signing on as a co-sponsor. That's the Moms Matter Act. And if you have just a minute, I'd like to tell you why it's really important to me. Are you the right person for me to speak to?
Yes, thank you for calling. I would really like to hear more. First of all, would you mind giving me your address, please?
Oh, sure, absolutely. I'm at 690 Matson Drive in Napa, California, 94558.
Oh, okay, great. Thank you for that. Can you tell me what that bill number is again?
Yes, absolutely. So it's HR 909. It's also known as the Moms Matter Act. So it's part of a larger bill package, but this bill in particular is really important to me because it focuses on maternal mental health. I, being a person here in Napa, thought that I wasn't at risk for a maternal mental health complication when I had my son. But I actually went through struggles that really impacted and changed my life. And there are aspects of this bill that would have really impacted my motherhood journey. And what it's going to do is lay the groundwork and foundation for even more people to get help. We know that maternal mental health disorders are the most common complication of childbirth. And I think this is something that the representative should sign on to. And I think that mental health is really important to him. We've talked about it in the past, so I would greatly appreciate his support today.
Yeah, thank you so much, Crystal. I'm really sorry to hear about your experience, but thank you for calling because this is how we make changes, is hearing from our constituents. I personally do not handle these specific issues, but my colleague Sue does, and I would be more than happy to give her your contact information if that would be okay with you.
Oh, I would greatly appreciate that. Thank you so much. Is Sue in your DC office as well, or what's her role?
Yes, she is, and she does all of our healthcare policy work.
Oh, okay, fantastic. Yeah. I would, if you can give her my email, that's Crystal, CRYSTAL at 2020mom.org. And do you mind sharing her email with me as well?
Oh,
I'd love
not
to
at all.
have her follow up. Okay, thank you.
Yeah, her name is Sue, SUE .Jones, JONES at mail.house.gov.
Okay, so I have sue.jones at mail.house.gov.
That is correct.
And your name is Becca, is that right?
Yes, it is. And please feel free to email me as well. It's Becca, BEKAH Bischoff, BISCHOFF at mail.house.gov. And I will also email her to make sure that she looks for your email. And I will make sure that Congressman Thompson knows about this as well. And I just really appreciate you calling, Crystal. And again, just thank you for bringing this to our attention so we can help to improve this for future moms.
Thank you so much for your time today, Becca. I will look forward to email follow-up with you all and hopefully seeing his name on HR 909 as a co-sponsor very soon.
Okay, thank you. Goodbye.
Bye. So there we are. We're so nice, right? We have just some feedback from prior times we have made these calls. Thank you, Becca. I love your acting. Is that you might get a voicemail. You might get a full voicemail. You might get redirected to another office. You might, so there's all sorts of ways this could go. That's obviously, Becca's a very nice staff member who is very polite and kind, really enjoyed talking with you. But just be prepared for all sorts of things that can pop up like that. So we have a couple questions in the chat and then we'll turn it over to you all to make phone calls. Was everyone able to get into the script? Okay, let me fix that right now. Thank you, Sam.
Thank you.
My pleasure. Let's see. Okay, that should be right now. Can everyone get into the script now, which says support for HR 909?
I haven't sent the link.
Oh, okay. Yeah, it should work now. Thank you. Oh, thanks, Beverly, for your question. Yeah, it should be coming to you right now. And then does anyone else have questions about the bills or about the calls you're going to make? Has everyone, oh, let's see. Oh, thank you, Rosalie. That's a great question. And I actually skipped right over that. So Sam, I'm going to take over the screen share for just a minute because Rosalie just reminded me that I glossed right over seeing how people are already signed on. So let me drop 2 links for you into the chat right now. The first one will be for HR 909. This is going to take you to the congress.gov website. I'm sorry, S484 is first. That's going to take you to the Senate congress.gov website and show you who's co-sponsored already. And the second link is for the House bill. So here comes my screen share and I will show you what we're looking at. So on S484, that first link, you are looking at the Moms Matter Act, and these tabs here, you can scroll all the way over to where you see co-sponsors. And right underneath here, you can see there's only 3, but there are 3 co-sponsors listed there. The second link I sent is for HR 909, the House side of the bill. There are 38 co-sponsors here. So you can come over here and sort either by date, which would be first to last, or alphabetical by name is generally the easiest for you to see, and it will go by order of last name here. There is a part in the script there offered for you. So if your representative or senator is already signed on to the bill, we actually had a conversation this morning and somebody said great language to use is to call and say, I want to thank you for recognizing the importance of the Moms Matter Act. And as a constituent, I would greatly appreciate you keeping the momentum alive for this bill amongst your colleagues, encouraging them to ask people that they work with to co-sponsor with them. Okay, I'm just going to check the chat one more time. Did everyone able to get into the script and see the questions there? Main reminders are let them know you're a constituent because that's who they want to hear from. Let them know that you're calling specifically in support of the Moms Matter Act here on Mental Health Action Day. And then give them that information. I'm going to turn the screen share back over to Sam and ask Sam if you'll put up the slide that has the bill numbers on it, HR 909 and S484. I think that's super helpful for people just to have a quick visual for when their person says, what was that bill number again? Thank you very much. All right. Keep the questions coming in the chat if you have them. Thank you, Alice, so much for being here. It's great to have you here today. And yes, we'd love to encourage the reps to encourage their colleagues. So I'm going to go ahead and put everybody on mute and give you about 10 to 12 minutes. We'll check in periodically. If you have something you'd like to share, send it to us in the chat while you're calling your senators and representatives. And thanks again for your time. Hi, everyone. I know that a lot of you are on the phone or maybe leaving a message. I put this in the chat, but wanted to point out that Celeste had a really great question. In are there some reps and senators who are listed as sponsors on the overall momnibus bill package, but perhaps not on the specific sub-bill? And the answer to that is yes, there are several reps and senators who have signed on to the 12 bill Black Maternal Health Momnibus package. The reason that we're focusing specifically on this one bill today is because if the entire package does not move, we still want this one bill to be successful. So if the entire bill for some reason does not continue to move forward, at least this one could be picked up, taken out of the package, and continue to move through the legislative process. So thanks for that great question. Kay, did you get somebody on the phone? Yeah.
Finally, I am determined to get the Senate, Sheila Jackson Lee, to sign on. I still can't fathom why she's not on. I call her on my off time just to remind her office that she needs to sign on. Yeah, I don't want to have to call her out here.
I know.
you know,
I
when you see people, when you see your reps show up in other ways, you want them to show up in ways that actually are beneficial to you. Like if you're saying this is who you're for, what you're about, I'm concerned that you're not already signed on to this. So yeah, I like I said, I called them on my off time. When it pops into my head, let me dial this number real quick. So yeah, today somebody was actually answering phones. So yeah.
Well, good. Well, I'm glad you got someone on the phone. I just got someone to answer the phone and I said, I'm following up about a message I left a couple of weeks ago. Oh, so I'm going to call my senators now. So I've got 2 more calls to make. I've got a couple questions in the chat that we're going to keep answering too. So you guys keep going, keep up the good work. Okay, so I just want to circle back. We have about 5 minutes left and see, do you all need some more time? I see a couple great messages in the chat saying that got to leave some messages, planning on sending some follow-up emails. Anybody else need some time or have a great interaction you care to share? Becca, did you get anybody on the phone today?
I did, and I got the same email contact that I have gotten the last several times that we have talked, specifically with the House rep. And I'm looking forward to emailing. It was funny because the person that answered the phone asked for my address. And then at the very end, he said, are you sure that, where did you say you were from? Are you sure it's the district? After he had given me an email address. And I said, yes, I've met with the office before. And then actually have a meeting scheduled with one of my senators for next Tuesday. And so I mentioned that in the call that I wanted his support, but that we would also be meeting next week as well. So they were great calls. Going to continue the work and just appreciate everybody else on the call who was able to get through or maybe didn't get through, but know what to do now.
That's awesome, Becca. Thank you very much. I just wanted to read aloud a quick question from the chat to make sure everybody got to see it in case there was anybody else who needed to get a response. Let's see. Does anyone know if there are other bills up currently that would support HRSA grants for additional states to request funding for perinatal psychiatry consultation and access programs like MCPAP for moms? Looks like this is under SAMHSA, so not sure if the same type of funding could be requested as part of that. Thank you. So the response is here. So Celeste, thank you for your question. The bill is forthcoming and being introduced by the Maternal Mental Health Leadership Alliance. And I think Adrian's on the line. I think I saw your name earlier. If you're here, Adrian, hello, and thank you for your leadership. There's already been a $5 million budget request approved within with their support. So I hope that answers your question, Celeste. And thank you everyone for your feedback. Kay, is there anything you'd like to say in closing today before we go?
Yes, I definitely would like to thank everybody for hopping on and joining us today. This is going to make all of the difference in the world. Your support is greatly appreciated because our voices do matter, and it's our voices that are going to move this forward and get this passed. And then in the latter of this, really, truly make shift happen as far as our moms and the care that they receive. And how this will all come full circle. So thank you again for taking time out to join us for this.
Well, thank you, Kay. Thank you for your leadership and your dedication. It's always an honor to stand beside you while this work gets done. And I have great hope and faith that this will be the year for the Moms Matter Act. So you all will continue to hear from us. We had somewhere in the 30-ish range on our call live today. We had just under 100 people registered today. So know that if you didn't get an answer today, both of the phone calls that were answered for me were people who said, oh, you did call before. Oh, we would love to follow. Oh, yes. So that second phone call matters. The third phone call, the email follow-up is really powerful. Hey, I spoke to Kay in your office this morning, and she said you would consider this co-sponsorship. So please feel empowered by all of us to continue to do that. And let's get this done. Let's get it across the finish line. And thank you for your support. Everyone's sending you all lots of love, and thank you for taking your time on Mental Health Action Day. Bye.
Bye, everyone.